offer therapy. We also offer diagnosis. So most of the time when parents come to me and said, I'm really concerned about my child, he's not talking or she's not talking yet.
Is that the number one? My child is not
talking. Yeah,
he's
not talking. So that's why they come. And I then bring my chart and I said, but in the hierarchy of communication, talking is at the top. We need to have social engagement, I said. We need to have play.
Wow.
We need to have body movement, all of this. Then language comes. I mean, thinking first, emotions, and then language. So if the child is missing the fundamentals, is not going to talk. So we need to teach your child how to play, meaningfully for entertainment, for joy, how to role play with a doll, for example, how to engage, or rather than my child needs to talk. And then another question I get asked, when are they going to talk so they can tell me what's wrong with them? And I said, okay, again, we don't have a magic wand. We're going to try our best. And that's why we have created this bespoke therapy plan, incorporating different schools and different thoughts of school to have the best plan and achieve the best goals for a particular child. So I say to parents, what is important to you? For your child to speak or your child to communicate? Because there are two different things. Speaking, which is the last thing in the hierarchy of communication, for some children will never be possible, and that's the case. However, there are loads of other ways we can teach your child to communicate. We can use Perloco2Go, it's a software we use routinely in our sessions, which will also provide training for parents. Then we use PECs, another form of picture exchange communications.
Lovely.
We use object of reference, so the child has a physical object of, a particular, going to having a brush, it's bath time, or having a toothbrush, or having a pot because it's dinner time, etc. We have visuals, visual card. So there are several ways of teaching a child how to communicate. And as far as we teach them at least one of those methods for them to express their immediate basic needs, I think we've done